Hello, my name is Dr. Constance Okeke. I'm a glaucoma specialist and cataract surgeon. I work with Virginia Eye Consultants, and I'm also an assistant professor of ophthalmology at the Eastern Virginia Medical School. I think that the most important factors when considering management for glaucoma are, one, the stage of the disease. I think that it's important to be able to tailor your management depending on that so that you can figure out what is going to be most efficacious. I tend to also include the patient a little bit in the decision of the management. For example, when a patient is diagnosed with glaucoma, I always allow them to know that there are 3 different options for treating the glaucoma, all aimed at lowering the eye pressure. Either using medications, typically in the form of eye drops, using light energy laser treatment in order to help the outflow channels or the drainage system work better. And then there's different types of surgery that can be performed, whether minimally invasive or more traditional glaucoma surgery. I let them know because there are times when the patient also knows themselves to help to tailor the decision. For example, if a patient knows they're not going to be a good drop taker because they're not consistent, or they know they have a lot of allergies and it's hard for them to put things in their eyes, I'm going to maybe steer away from thinking as a first-line medications and offer some type of laser treatment at that point. Also, if a patient's been on a number of medications and I see that they've been having problems being compliant, I'm very quick to start talking about minimally invasive glaucoma procedures as an option. So deciding where to begin has a lot to do with the stage of the glaucoma, as well as also understanding what your patient's needs are and helping to tailor the disease that way. My thought process on adjunctive therapy has actually expanded. Just like we have different classes of medications, we don't just consider using one. We can actually use them in conjunction with each other because of the various mechanisms of action. They can actually act in a symbiotic way. Similarly, we have various minimally invasive glaucoma procedures that have different mechanisms of action, and I've found that you can do one procedure, and if that procedure, say, works for several years and then begins to become less as efficacious, you can actually use another MIGS procedure to follow that up with a different mechanism of action that can still also have pressure lowering ability. So this MIGS after MIGS has allowed for us to use different procedures that are surgical in an adjunctive way. In terms of medications, we have a number of new classes of medications that have come out with the Nurtazidil or Repressa, which is an adjunctive medical therapy that is simple because it's once a day, and also it's advantageous because it's a completely different mechanism of action. Whether used as a single line agent or an adjunct to other medications, it can add additional pressure lowering. Also, similarly with the Vyzulta or the lantanoprazine bunod, that medication has a dual mechanism of action, and it and of itself is almost like a first line and adjunct in one. So there's a lot of different technologies, whether medical or surgical, that can aid in using them in an adjunctive way.